Now, a new study out of Germany using antibody testing shows that the coronavirus may not be as fatal as once previously thought. The study focused on one of the hardest hit regions in Germany called Heinsberg. It found that 15% of the population had antibodies for the virus in this area, suggesting they'd had the disease already, with a mortality rate of 0.37%. That's less than 1/5 of the mortality rate considered in Germany as a whole. Joining us now, the scientist behind this research, Professor Heinrich Streeck. He's a director of the Institute of Virology and the Institute for HIV Research at the University of Bonn. Professor, good afternoon to you. Thanks so much for joining us.
Good afternoon.
I guess so. The starting point clearly is a very concentrated area of infection in Germany where you've done a lot of testing, and the encouraging result of that is a much lower death rate than previously thought.
Yes, so what we did was a representative study within this area where we had a high prevalence of cases already. So it got hit pretty hard by COVID-19. But the surprising part, what we found was that there were 15% in that population that didn't know that they had an infection. And overall, that we are calculating a case fatality rate, so how many people are actually dying of that disease in that population, is 0.37%. So this case fatality rate is not actually different probably in other countries, but that we can assume a pretty high rate of infections that are asymptomatic.
Does this suggest to you that the prospects originally of herd immunity are ones we can believe in and we can hope for, or do we still need to take an approach of containing this virus in all nations where possible?
So the initial containment is important because we also in Germany had some super spreading events where we had many people infected at the beginning. And this led to like an overwhelming of the healthcare system. But if you're now in that phase to stop this super spreading event and you're starting the typical measures of hygiene and social distancing, we are now seeing that these are enough measures to actually contain or control the viral spread enough that at least in Germany, our healthcare system is not going to be much overwhelmed. So we're going to stay within our capacity of intensive care units, beds.
Professor, there's been a lot of talk so far based on the data that does exist on the fact that this is a virus that at least to this point has not mutated the way we have seen, for example, strains of the flu mutate and require new vaccines every year. What is your research so far yielding in terms of that? And how much does that then, I guess, shape the narrative for how economies, how people do actually get to go back to work, not only in the near term, but in the longer term?
Well, we have not done any research now on the mutation rate or on the mutations in general of COVID-19 or SARS-CoV-2 right now. But generally, what you know is, like what we are seeing in most of the viral infections, that when it's being passed from human to human, that it loses partially their virulent factors. So it's becoming less virulent, becoming less lethal. So it's kind of adapting to the human system, but at the same time is becoming less severe. But for measures that are being taken and the political decisions, I'm a virologist, that's something I cannot really comment on.
Professor, it's encouraging what you're saying as it relates certainly to Germany about perhaps 15% containing the antibodies so that they're now immune to the virus. Earlier today on CNBC, Becky Quick interviewed Bill Gates. I just want to play you a soundbite from that interview because it relates to what we've just been talking about, and then I'll follow up with a question.
Serological testing, the idea that you could test and see who's got antibodies in their blood and then maybe say perhaps they have immunity. Does that sound like a good plan or something that we should be working towards?
Well, it's not very interesting because the extreme measures we're taking are to try to make sure that the total infection rate is a small percentage of the population. So the U.S. we should end up with less than 10 million overall infections. So that 10 million out of 330 million is not a meaningful amount of herd immunity. Now, those people, the most interesting thing about those people, maybe they could go do risky jobs, but the thing we're working on, we have 6-company consortium, is to look and see if the blood in 2 different forms from those recovered patients can be used as a prophylaxis or therapeutic in people who are getting sick.
Professor, do you disagree with the theme, the sense of what Bill Gates was saying there, or is it just a case that perhaps Germany's in a different position to the United States so far?
Well, I very much respect Bill Gates. I met him a couple of times, and he's very intellectual and intelligent, smart man. And I think going for the therapy is a good way to use antibodies as a potential way of treating very severe cases. It might be that Germany is in a different place, but I think there's a larger amount of immunity ongoing already in the population, at least what we're seeing in Germany. Now, seeing some of the pictures in New York with very severe cases and where we assume a high case fatality rate, I actually think, or I believe that in New York there are many more being infected because I don't think that the case fatality rate differs between countries much. It's the same virus, but that there are just much more unknown cases of infections in that cities.